Hey,
Dr. Bonsu.
exchange of energy.
You already know what time it is. We out here.
Hello, everybody. Thank you for joining me today. You know, we have a very special guest. I'm so excited to speak about it. You know, a legend at the Keck community. You know what I'm saying? He's actually my big. So you know we doing it big. You know what I'm saying? I'll call him Nana, but y'all should probably call him Dr. Bonsu. Come on, man. Let me say what's up.
What's going on, man?
BIM, what's
Hey, we out here, man.
You already
We out
know,
here.
man. Take a seat, but this is your crib, so.
Yeah, man. This is my house, so you take a seat, man.
All right, yes, sir. You know,
let me be a good host.
Yeah, he got the coat on. You know, I'm sorry, doctor.
Yeah, man.
How you living, man?
I'm good. I'm blessed, man. I can't complain, man. Life is good, you know. Just doing my thing out here, so, you know.
Hey, man, I'm trying to be like you, bro.
Hey.
On everything.
One day, man. We all gonna get there. You know, it's just a journey. You know, we all been on this journey. It's the same struggle, man, but, you know, we just gotta do it.
That's real. Look, we just gotta do it.
Yes.
All right. I know everybody know you, but some of them don't. You know what I'm saying? So, can you just introduce yourselves? You know, say where you're from, maybe what school you went to, your major. Sit.
Yeah. So Nana Bonsu, originally from West Covina. My family, Ghanaian immigrants, came here in the 80s. You know, West Side, Africa, stand up. You know how it is, gang. Yeah, went to UC Riverside for undergrad. Graduated with a degree in biology, and then I also got I did a post-bac program at San Francisco State University before starting at Keck School of Medicine in 2015. I also got my MPH while I was there. So, yeah.
Just degreed up, man.
Hey, man.
You know,
just keep adding them letters at the end of my name.
Hey, man. They're going to be like, hey. Them the letters when they say it. Not for real. Not for real.
Yeah, man. Yeah.
All right, just, you know, keep it kind of light. You know, how would you describe yourself? You know, I know that's kind of introspective, but
yeah,
tell them young boys how to do it.
Man, how would I describe myself?
Any way you want.
I would say that I am a very laid-back, relaxed individual. You know, I don't sweat the little things. You know, very open, very curious about things. I just like learning. Like, whatever it is that I can learn about, I just want to learn about it. Whether it's, you know, what's going on in the classroom, or whether it's somebody's culture, or whether it's a new restaurant, or...
Well, you be getting all the good eats.
Hey, you know, man. I be eating good.
He a doctor already, boy.
Hey, man. We got to eat good out here, man. You know?
Set the tone.
So, yeah. I think those are the things that describe me. And also... just empathetic. Like, I try to empathize with people and just try to see where other people are coming from, you know. And yeah, I mean, I think those are all the ingredients that make Nana. So
okay, yes sir.
Yeah,
yes,
man.
sir. I like the recipe.
Yes, sir.
So in that way, I know it's kind of random. Just have you ever had any nicknames growing up? Nicknames?
Had any nicknames?
Family, friends?
Yeah, I mean, amongst my family, everybody just calls me Nana. My mom, she calls me Yao. In high school, actually, like on my football team, they called me Neezy.
Neezy.
Yeah.
Okay.
So it was like Naneezy.
Naneezy.
You know, that was the name in high school, but you know, pretty soon it'll be Dr. Bonsu. But you know, MD loaded.
Ooh.
The MD's
I
loaded.
already got everything else. For real.
Yeah, man.
All right, yeah. Just so y'all know, he knows some of the questions I'm gonna ask, but a lot of it's just random. And, you know, I gotta catch him slipping. You know what I'm saying? So he don't really know what's happening with all of this. But there's some questions that I wanted to speak on that we talked and that we spoke previously. We want to keep it consistent with everybody that we speak with. So it's kind of how we're gonna be doing it. So just to get it started, you're in medical school now. If y'all don't know, you know, my boy is 4th year, running things, you know what I'm saying? General surgery,
Yes.
you know. He's a surgeon, you know, just like every black person you run in the street, they want you to be, you know what I'm saying? Look, he living the black man dream, you know.
Man.
So that's what's up. Just in terms of getting to medical school, what do you think like the hardest part was? And so part of it is I wanted them to read the answers that they previously given me when I polled them, like even months ago or even years. Who knows? But also I want them to kind of explain a little further. So he has his results that he put previously. So let him do it. Hardest part about getting to med school.
So the hardest part about getting into med school for me, I'd say, was the MCAT. I actually took the MCAT twice. The first time that I took it, I can say that I didn't put forth as much effort that I needed to, and
Why not?
Well, I mean, I thought of it as just another test. I think when you hear about the MCAT, you don't really know what it is until you take it. And I think I really just downplayed what everybody was telling me about the difficulty of that test. So
Were people telling you how difficult it was?
Yeah. I mean, I took a MCAT prep class, so they emphasized how difficult it was and the importance for strategy. And I feel like I had always been a great test taker, but going into that test, I was not as prepared as I needed to be.
Did you know you weren't at the time, or did you kind of like maybe see how it goes?
I knew I wasn't. Yeah, I knew I wasn't. I wouldn't say that I had all of the focus that I needed going into taking the test. And I think I just needed to mature a little bit and really just take the time to sit down and really digest that material and really just put the work in, because I think that's the most important thing, really putting that work in and striving to make yourself better each day that you take it. And it's a long journey. It's a long path.
How long?
Man, so I studied the second time around when I took it, which was when I was in my post-bac program.
During the program you took it?
This was, towards the tail end of my program. I was taking a lighter load of classes, and I treated it like a job. It was... I would go to class. After class, I'll go to the library, study there until...
For how long?
I mean,
like stuff like this is important.
Definitely.
Everybody's different, so we shouldn't all use the same strategies.
Definitely,
for sure. But it gives you an idea of how much time people are putting in.
Definitely. The days that I did have class, I would go into class at 8 in the morning. I'd probably be done around 10, and I stay at the library till about anywhere from 6 to 8.
Every day throughout the week,
and this is every day. And I would take one day off during the week.
Weekend or week?
During the weekend. So I'd take Sundays off or Saturday off, if I wanted to go do an event or something like that. But I treated it like a job.
How long were you working then?
3 months.
3 months.
3 months. Yeah.
So you had that schedule for 3 months, or you got into that schedule? You say.
It took some time to get into that schedule because to sit down and study for at least 8 hours a day. That ain't easy. Like,
well, who you telling?
Yeah.
Ain't nobody ever had to do that.
Yeah.
Most people have never had to do that.
And that's why I say that the first time I went in, I wasn't prepared. Because. I didn't realize that it takes this amount of dedication and this amount of commitment. And, again, like as you said before, for some people, they don't need that much time. Or some people, may need more time. It really all depends. But I know myself, like I needed to just constantly put that work in, to be able to get the results that I wanted, that I could be proud of. And
so about how long in your time when you were studying for it did you begin to see, start seeing results that you wanted to see? How long from when you started to when you was like, okay, this is working?
Yeah, it was all incremental. There's going to be some good days and there's going to be some bad days. Some days where you really get violated on these problem sets, verbal section, which is the car section, which is now the car section. But, a lot, it took time, but you have to be able to celebrate the small victories, but also understand that you have a goal. And, you should always be constantly trying to strive for more and try to beat who you were yesterday, So I think if you just keep these small little goals in mind, eventually you'll get to a point where you're like looking back and you're like, wow, I came a long way.
Yeah.
So,
when you were taking it that second time, did you feel like you were ready?
I did. I was nervous,
of course,
and I feel like you never necessarily feel like you're ready. At least that's how I felt. Like, it's always like, man, I could, like, if I just had another week, I could, like, study some more and I could, like, review some more things.
Better.
Yeah, but when I was taking the test, my last practice test, I was hitting, like, scores that I felt good about. Going into the test and taking the test, I felt good. I just tried to stay calm and stick with the game plan, stick with what I knew I was doing before that worked for me. So
appreciate that, man. I know that's definitely insightful. MCAT is different for everybody and a beast for everybody. But
definitely.
Gotta do that.
Yeah,
gotta get past it for sure.
Necessary, very necessary.
Okay, so the second question I asked, which is, what was the most important thing that got you to medical school?
So the most important thing that got me into medical school was, I would say, having positive mentors. And, it was something that I didn't necessarily realize, I think, until much later on in the process. It was, I had... Closer to when I was applying, there was a doctor that I was shadowing, and he just gave me a lot of advice, a lot of insight.
Like what did he say?
How many schools I should apply to?
Okay,
where I should look to apply. What are things that schools look for? They want. I think a lot of schools, medical school it's a journey, it's a marathon, and schools have to invest in students. As much as, we do pay to go to medical school, the school is also paying for us to have this education. So they want to know that they are getting somebody that can be committed to something. So, highlighting what your passions are, highlighting that you can be somebody who can be interested in something and be very passionate about something and put a lot of effort into it and work hard at it.
Work real hard.
Work real hard at it. Because those are the type of people that they want.
That's what it takes.
And so these like having him tell me these things, and also just seeing his bedside manner with patients.
Who are we talking about? Might as well put a name.
Well, I mean, this is
multiple for sure.
Yeah, multiple, but in particular, I would say this is Dr. Joseph Carey. He's actually at USC now, plastic surgeon.
What?
He's amazing. Yeah, incredible doctor. But I mean, seeing
mentors.
Seeing him, having somebody that you could look up to and somebody that could show you the way. I think that was very helpful. And your mentor could be, you can have multiple mentors. At various levels too. You could have somebody who's a doctor, somebody who's in medical school, somebody who has already applied, people that are even at the same level that you're at. I think that oftentimes you can learn something from people, when you may not even be expecting it. So,
people who are next to you.
Exactly.
All of that.
Exactly.
I just switch it up a little bit. Medical school is a huge journey. It's difficult.
Yeah.
From 0 to 10, first of all, how difficult is it?
What, getting in? Or
getting in, staying in?
It's much easier to stay in than to get in.
Okay, getting in is a what?
Getting in is, I'd say
0 to 10. We don't need no commentary.
Jeez. Damn. I would say a 8. Yeah, I'm gonna say 8.
And then staying in med school.
Staying in med school is, you're just going through the motions at that point. But it's still a lot.
0 to 10.
5.
Okay. Oh, okay. Yeah. So getting in is the hard part.
Definitely.
But staying in is it easy? Is that what you're saying?
Staying in is once you're in, you're in. And like I said, just going through the motions and doing the things that got you in, just maintaining a lot of those things. And just working on that constantly, as I mentioned before, just constantly working on improving yourself and getting better.
And so, you know, just trying to get better every day. Like, what keeps you going?
Man, I would say my family, and particularly my mother. My mom is, you know, she's always been my number one supporter. And she is actually like my inspiration for even going into medicine in the first place. So just remembering why I'm doing this, and what brought me to this field in the first place, you know.
What brought you?
So I mean,
real
it was,
quick version.
Yeah, I mean the Spark Notes version. You know, my mom, she was sick. She had breast cancer, and you know, I went with her to a lot of her chemotherapy appointments, and you know, while attending a lot of these appointments with her, I saw some, you know, really good doctors who helped her get through what she was going through, and then I also saw some really bad doctors who almost seemed like they were just there for the paycheck, and my mom was just another, you know, medical record number that they had to treat. And
what is the percentage of that?
I would say that there was more good than there was bad, but seeing the good made me want to be somebody that could provide that for somebody. You know, I wanted to be able to get somebody through a tough time that they were going through, you know, and not just through the medical sense, but also through, you know, my compassion for them and my empathy and just being there for them, you know, because I think that is something, the mind state and the emotional trauma that people go through when they're sick, that's a big thing, you know, that I think oftentimes gets downplayed. So, yeah, I wanted to be able to provide that for people. So that's what pushed me.
Have you been doing that?
How have I been doing that?
No, have you been
Oh,
doing
yeah, definitely. Yeah. You know, as a med student, you have time to talk to patients. And so I make sure I sit down with patients and, you know, find out what's going on. Like, find out what their thoughts are about whatever it is that they're going through. And even having been a patient myself, I just recently like ruptured my Achilles. And
which one is it?
This is it's this one.
Oh, hold on. He can lift it up.
Yeah,
and things.
I could lift it
you
up.
See how you kick it?
Yeah, I'm about like 12 weeks post-op right now, so you know I'm out.
I had crossed up next week, is what he's saying.
All right, we disregard the nonsense.
Yeah, it's cool.
But you know, having been a patient myself, I understand. Like, I have a better idea of what it's like to be a patient, and it could be stressful. You know, can be a lot of uncertainty. You know, you're in a lot of pain. There's a lot of emotions that are running through your mind. You know, but to have somebody come and just sit down and talk to you and just ask, like, and genuinely, how are you doing? You know, I think that goes a long way. And so I've been trying to do that for my patients. And I
feel
think
like you probably are.
I get a positive response from my patients. So, you know, that's something that I just want to maintain now and continue on for the rest of my career as a physician.
I believe you will. I mean, I'm sure you're doing it. It's not just because you're a black man.
Yeah.
You know, they appreciate you in the hospital.
Yeah.
You know, just a unicorn. We've been talking about it.
Yeah.
In that way, like, this is a real quick switch up. And I'm going to ask one more question after this, and we're going to end it.
Yes.
But what is BIM, Brothers in Medicine? What is that to you?
Brothers in Medicine. So, this was a collective that we started here at Keck. So, coming into Keck, you know, my two current roommates, one of them, two other African American brothers, we thought that this was like a special moment for us to be three black men that are at Keck School of Medicine. And it wasn't just us, there was others other black men also at Keck. And in talking with friends at other medical schools, a lot of them said that they didn't have the same experience. And so we thought, we should use our privilege as black men in medicine that have made it this far to inspire people that hope to attain and be in the same position as us. So, it's a mentorship program, where we work with undergrads, and we just want to establish this cross-generational network where we provide, the information and the keys and the pearls that are needed to get into medical school, because we need more people that look like us, in this field, because, there have been studies that have shown that, a more diverse workforce in medicine leads to better outcomes. So, this is research. It's numbers.
Even in the same thing in business, they're saying people who have leadership of diverse backgrounds actually get higher returns and profits. So it's bigger than just the feeling. It also shows in the bottom line.
Definitely.
So we need that. All right, that's huge. I'm excited for BIM. Let's get it. Keck BIM, all that. Trademark. You know how we do it.
Yes,
just real quick, any advice you have for anybody that's pre-med that's trying to become a doctor one day?
Yeah.
If you had one thing you can tell them.
One thing.
And they about to run and they leaving, their mom's outside waiting for them.
I would say, before you go, look, just stay strong, persevere. Remember why you're doing this. Just know that this is not easy. It's a hard and it's a difficult path, but there are people that have done it before you. There are people that will do it after you. So you will be able to do it too. So you just have to remember what it is that brought you to this journey in the first place, and let that power you and push you through. Because it's important. It's important that we all make it, and it's a much bigger thing that we're working towards. So stay strong, stay resilient.
Okay, yes sir. Boy, you strong and resilient, man. You know what I'm saying? Not them ankles though. Look, my brother, one more time. You know what I'm saying? Thank you so much. You know what I'm saying?
Most definitely.
I love you, man. Keep setting the standard.
Likewise.
You know what I'm saying?
Likewise.
Hey, Finesse Network. Thank you, everybody.
PreMed Finesse.
You know how we do it, PMF.
Yes, sir.
Let's go, Canes.
All right. How long was that?
It's probably gonna be like 19 minutes.
Yeah, I feel like that was like longer than 15.
It was, and I was seeing it. And I was like trying to move. What's up, everybody? This is Lawrence Roll. Thank you for watching the video. I really appreciate it. Hope you learned something. Please take a second to join our online community, the PreMed Finesse forums, where you can learn from and speak with people who look like you at all levels. Anonymously, too, so we can keep it real. Black Lives Matter. Let's get this money.